Poliomyelitis, also known as polio, is a highly infectious disease caused by the poliovirus. It can lead to severe complications, including paralysis and death. Poliomyelitis, polio, is caused by the poliovirus. The primary mode of transmission is transmission 1. Fecal-oral route. The virus is shed in the feces of infected individuals and can contaminate food, water, or surfaces. 2. Person-to-person contact. Direct contact with an infected person's feces or contaminated surfaces can spread the virus. Risk factors. 1. Lack of vaccination. Unvaccinated or under-vaccinated individuals are more susceptible. 2. Poor sanitation and hygiene. Inadequate waste management and hygiene practices can contribute to the spread of the virus. Poliomyelitis, polio, signs and symptoms can vary. Common symptoms: 1. Fever, high temperature. 2. Headache, severe headache. 3. Sore throat, pain or discomfort in the throat. 4. Nausea and vomiting, feeling queasy or vomiting. 5. Fatigue, feeling weak or tired. Neurological symptoms: 1. Muscle weakness, weakness or paralysis in affected limbs. 2. Paralysis, permanent or temporary loss of muscle function. 3. Stiffness or spasms, muscle stiffness or spasms. Severity: polio can range from mild to severe, with some cases resulting in long-term disability or even death. Vaccination is key to prevention. There is no cure for polio, but treatment focuses on managing symptoms and preventing complications. Supportive care. 1. Rest. Plenty of rest to help the body recover. 2. Pain management. Medications to manage pain and discomfort. 3. Physical therapy. To maintain muscle strength and mobility. Rehabilitation. 1. Physical therapy. To help regain muscle function and mobility. 2. Occupational therapy. To adapt to daily activities. Prevention. Vaccination is the most effective way to prevent polio. The oral poliovirus vaccine (OPV) and inactivated poliovirus vaccine (IPV) are used to build immunity. Importance of vaccination. Vaccination plays a crucial role in controlling and eliminating polio worldwide. Thanks for watching the video. Please like and subscribe my channel for more videos.